Greetings, friends and followers. This is Nurses Talking. I am Dale Barcy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, I have the very great pleasure of welcoming Janelle Gibson out of New Jersey, USA.
You.
Janelle is a doctorally prepared, dual certified adult gerontology, acute care, and primary care nurse practitioner. She says that early in her career, somebody had the effrontery to tell her, she didn't use those words, but someone told her she was not suited for inpatient practice. And rather than
Mhm.
accept those limitations, she committed to mastering her craft by strengthening her diagnostic reasoning, refining decision making under pressure, and building true clinical confidence through discipline and resilience. And that
Yes.
journey, she says, now drives mentorship. And she created a program to equip novice acute care NPs with structured framework, sharpened clinical reasoning, and the confidence to practice decisively in high stake environments. Welcome,
Yes.
welcome, welcome, Janelle.
Thank you. Thank you for having me. Thank you. I appreciate it.
I'm sorry, I had to insert those words, the effrontery, to tell you. I mean, really. You know,
Yes. Yes.
here's the thing that I've noticed with stuff like that, though, is that sometimes when people tell you things like that, they think that they're putting you off, and very often it turns out that they just did you a favor.
Correct. That's exactly what happened. Just as you said. People mean things for evil, but God means it for good,
You know,
right? So that's exactly
I love it.
couldn't have been well said more than that. Yep.
Anyway, so start by telling me though, what inspired you? Who inspired you or what to choose nursing as a career?
So my mom is a nurse
Mm,
and I love my mom. So I wanted to help people just like my mom was helping people. And I knew she worked hard. I know that it wasn't an easy job, but I always had this innate love to help people. And I felt like nursing was the way to go to to fulfill
mhm,
that feeling that I had. And plus, again, like my mom is a nurse. She retired, but I wanted to be a nurse because I wanted to emulate her, and
mhm,
also to fulfill that desire to help others who are sick, in
mhm,
particular.
mhm.
Yes.
So you had this role model in your home.
Yes, I
And
did.
she, she walked that walk, that path so well that you wanted to follow. You wanted to follow.
Yes, I
But
did.
when you got there, was it what you thought it would be?
No, it was not. So, when I graduated from, well, first, let me just start by saying that when I got to college, I underestimated how difficult nursing would be. So I was not very focused on my studies. So
Mm-hmm.
there were a couple classes that I did, like anatomy and physiology. There were a couple classes I didn't pass, and I had to retake them. And that was an eye opener for me that this is something that you can't memorize. This is something you need to understand.
Mm-hmm.
It's not something that you can recite. You really need to understand and apply. So I learned that pretty early on. And what happened was, as a result of me not being focused in the beginning, my GPA was a 2.99 when I graduated from school. So although and anybody, of course, all of us know when you're in school, when you're trying to improve your GPA, it takes forever. So even though,
Mm-hmm.
like, after then I got all A's and B's after then, it didn't matter because that initial setback really took a toll on my
Mm-hmm.
GPA. So when I graduated 2.9. 2.99. No one rounds up. It's a
Mm-hmm.
2.99. So
Mm-hmm.
back in 2005, when I graduated from nursing school, they were offering 10K for those, or 5 to 10K for those bachelorette nurses who, because at the time they were trying to get more people to have
Mm-hmm.
bachelors. So
Mm-hmm.
they had a incentive. Oh, if you come with us, we'll give you 10 grand sign on bonus, this, that. So one of the recruiters said to me, "Oh, she said, with these grades, you'll never pass the boards on the first try." I said, "Oh, you've met me for 5 seconds and you've already determined what my capabilities are. We'll see." So let's talk about 15, 20 years later. I passed the boards on my first try. I passed my adult gerontology certification on the first try. I passed my acute care certification on the first try. I've passed my CCRN exam on the first try. So it's just to show that just because someone looks at you at face value, that doesn't mean that that's where you're starting. That doesn't mean that's where you're going to end. Yeah, I had a rough start, but that doesn't mean that that is where my end game is going to be. So in between starting off like that and then in the nursing profession, I dealt with there was a lot of bullying. There was people trying to discourage me from pursuing, like if I wanted to get into the cath lab, people would block me from jobs. I've had people say negative things about me to someone trying to call in for a reference, and it was of no basis. It was just because they just didn't want me to leave and they didn't want to see me move forward. I was in positions where I was in I was working in like a cardiac surgery unit where people would try to intimidate me and make me feel like I didn't belong there, when in fact they knew I belonged there. They knew I was excellent at my job, and it just made them uncomfortable because they felt like I would be better than them. So there's lots of reasons why people try to bring you down, and it has more or less to do with it's not about you, it's about them. So they see something in you, right? They see something in you that makes them uncomfortable, and they could foresee that this person is going to be really good. So when a lot of times, particularly in high acuity environments, like for example, cardiac surgery, you will get some of those kind of personalities in that area where they feel like they need to intimidate you and make you feel like you don't belong. But there's one thing I always say: whosoever God blesses, no man shall curse.
And there you have it.
So there's nothing that anybody could take away from you that man upstairs has in store for you. So I said, I'm not letting anybody intimidate me and make me leave when it's not my time. I'm going to leave on my terms and when I'm ready. That's exactly what I did. So in between that time frame, no, it wasn't an easy road. No, I didn't, I just graduated and just breezed through. I had a hard time, but how I look at those times now, as I didn't before, but now I realize that was a call for God to tell me to level up, right? You got to be better. So although people might mean things for evil, it was meant for good, because he used those experiences to elevate my nursing skills, right? So when I look back over the years, as I am now, where I am now, I'm very grateful for all of those experiences, because that is what I needed in order to become the person I am today, to fulfill my destiny.
Yeah. And you said something in the start of that I think is very important, and is one of the reasons that one of the things when I talk about on this channel is the way nurses are perceived. You talk about in your first semester, in your first classes, you were not very focused. Right?
No.
I think that happens to a lot of people because they don't anticipate that nursing and nursing school is going to be difficult. And I think that has to do with the way that nurses are seen. We're not seen as, and so, if you see people as second class citizens, you see already that what they're doing is not going to be something difficult. And people get a shock when they get into nursing school. Like,
I sure did.
A minute.
I was one of them.
Wait a minute. It's not as easy as I thought.
Yes, it is not. No. So I learned my lesson the hard way, and that my GPA took a hit for that. So yeah.
That's all right. That's all right. As you say, that was meant to make you level up.
Correct.
You already talked about, being in high acuity areas, but what attracted you to those high acuity areas?
So when I worked in the cardiac cath lab, we used to do we at that hospital we took care of a lot of heart transplant, heart failure patients, and a lot of the transplant patients would come down for a biopsy to make sure that they weren't rejecting. And some of them that came down were so sick, they were on all these drips, and
Mm,
I was like, wow, like I would love to do something like this. I would love to manage a patient like this. And I remember one of the nurses that was working with me at the time, she worked in cardiac surgery. So she said to me, Janelle, why don't God rest the dead? She said to me, she said, Janelle, why don't you go and apply? Like, go work there. And I was like, that's a great idea. So that was my introduction into ICU as a bedside
mm,
nurse, is because I was intrigued by how sick these patients were and how those nurses were able to manage them.
yeah.
And I wanted to learn how to do that.
Do
So
that.
it
Hmm.
started from the cath lab,
Yeah, yeah, yeah,
honestly.
yeah. Awesome, awesome, awesome. Interestingly enough, those are the things that adrenaline pumping thing that you
Yeah,
get from that acute thing. It's like there's nothing quite like it, is there?
it's true. Yep, it really is. It's that adrenaline, like that adrenaline rush is a
Yes.
real thing. So I was quite happy for the adrenaline rush. Initially I was having like palpitations and chest pain, but then afterwards I said, okay, I got this, I can do it. But initially I'm like, oh Lord, what did I get myself into? But then afterwards, after you get acclimated, you're like, okay, I can do it. I can do it.
All of a sudden, all of a sudden, you can do anything.
Correct, correct.
But you shifted. You became a nurse practitioner, though, and and
Mhm.
and here I talked about also you shifted, and you mentor, um, novice nurse practitioners. And one thing I want to ask is this: it has to be a mindset shift.
Correct.
So, what is the biggest shift you think nurses need when they step into a nurse practitioner role?
So the biggest shift is them, one, believing in themselves, because a lot of times they suffer from imposter syndrome, they
Mm-hmm.
suffer from lack of confidence, maybe their clinicals weren't great, maybe they didn't have the best schooling. And I think what helps with the transition from thinking as a bedside nurse to a clinician is that you choose a school that will help give you the best opportunity to do well. So a lot of times people might go to schools just because it's convenient and most of it
Yeah.
is online, and then they don't prepare you clinically. So then
Mm-hmm.
it shows when you graduate.
Mm-hmm.
So I can tell those who had a great schooling, who had good education and who had good clinicals. And I could tell those who struggled.
Yeah.
Okay. And
Yeah.
I could tell, like, okay, this person, um there's some fundamental areas that are lacking.
Lacking.
And it wasn't taught in school, or it wasn't picked up in school. And it maybe wasn't also um into practice in clinicals. So it's very evident when you see people, like, you know that they are, that, because a lot of people underestimate how hard it is because they
Mm-hmm.
see so many people doing it. So they feel like, oh, I'm a bedside nurse. I could just be a nurse
Just
practitioner. No, you cannot. You have to get the education. And some people feel like, oh, I'm better than those nurse practitioners. That's what you think until it's time to make decisions where patients' lives are based on what you say. So it's
mm-hmm.
easy at the bedside to say, "Oh, you should just do this and you should do that," until your decision is what actually counts. Because you can't say, "Oh, I ordered this test," or "I didn't order this test because X and X told
That's
me
it. Yeah.
not to
Yeah.
do it." It's your
Exactly.
license, it's your decision. You have to make it. So when you're the one making the decision, that's when things change. So the shift from believing in yourself and practicing, and then also moving from bedside nurse to clinician, is the hardest part, that I
Mm-hmm.
think people have that mind shift. That's the tough part, I think.
Mm-hmm. 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 Yeah. 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 I think you just answered what my next question was going to be. The difference between knowing the task and truly developing the clinical reasoning. false
Yes. So
diagnosis.
yes. So then to further add to that is that a lot of nurse practitioners might, I call it, they have memorized medicine. So what does that mean? So there's a difference between memorized medicine and organized medicine. So memorized medicine means that, okay, you have a patient that comes in who is wheezing. So you associate wheezing with asthma. So you order a bronchodilator. But what if the patient has heart failure? You could
Mm-hmm.
have a cardiac wheeze. So
Mm-hmm.
when you practice memorized medicine, you just memorize the treatment for a
Yeah,
symptom.
yeah,
But you
yeah.
cannot do that because when it comes to actually putting the patient's entire picture into context, so this wheezing in context to what the patient's history, that is more relevant than just the actual symptom.
Mm-hmm.
So organized medicine, you are structured when you think. You think through and you have a structure and system as to how you're going to diagnose, treat,
Yes.
and come up with your differentials. You don't base it off of a symptom. You don't give a treatment based off of a symptom. You give a treatment based off of the clinical context of how the patient presents. And I think that
Yes.
is the biggest problem, I think,
Yes.
that I've seen.
Yes. Yes. Well, you know what? We see this all throughout healthcare, and we're talking about nurse practitioners now, but I can expand this
Mm-hmm.
to the other ones, you know.
Correct.
Same thing. Same thing.
Mm-hmm. Same thing. Same thing.
Mhm.
Task
Mhm.
oriented nursing, things like
Yeah.
that.
Yeah.
Not thinking through, just doing tasks without actually thinking like, does this make sense? Is
Yeah.
this appropriate? And just doing things because it's ordered. Like that's another thing where you just don't think through. You
Yeah.
just complete a task, right?
Yeah.
So
Yeah.
it's another form of the same thing.
So, what aspects, though? I'm going to switch a little bit and say, what aspects of nursing do you think you'd like to see change? You've been in this, 20 years now? Close to?
Yeah, yeah,
Close to.
20, yeah. Hmm. So I honestly like to see nurses transition from task oriented to critical thinkers. That is what I'd like to see. I'd like for nurses to be more proactive. I don't want to hear you say, "Oh, well, the doctor didn't order it." But okay, but did you advocate for your patient?
Hmm.
You
Hmm.
saw
Hmm.
that there was something that wasn't done. Did you call the doctor and say, "Hey, the potassium's 3.1. Do you want to, oh, the doctor was
Yeah.
just here earlier. He should have." No, no, no. This is what patient advocacy is about, right?
Hmm.
You want to
Hmm.
advocate for your patients. You want to shift from just giving medicines without thinking thoroughly if this is appropriate for this patient at that time. I just say, well, the doctor ordered it. We just have to get out of that. The doctor ordered it, or the such and such ordered it. Is it
Yeah.
appropriate? Move from task oriented nursing to critical thinkers, and I think that will inevitably elevate the nursing profession 1000%.
Yes, yes.
That's my view.
I have to say I absolutely agree. And the thing with that thing about, someone just ordered this and they didn't order that, is that you have to remember, apart from everything else, this
Hmm.
doctor, nurse practitioner, whoever it is that you're talking about, is human,
Correct.
you know?
Correct.
And
Yeah.
it may just be that you needed to bring it to their attention. It may just be that they just missed it because they're human.
Correct. And
Not because they're
honestly,
negligent, not
yes.
because,
No, it's just that
I,
sometimes like you might be in the process. Like there's times I'm in the process of putting in orders and somebody sends me a message and I
yes,
stop what I'm doing to answer that message
please,
and I forget about what what I was originally doing in the first place, right? So it
yes,
happens. Just because you're human, you have so many. So the nurses tend to forget. Like you guys may have like two patients, but I have the whole unit. I have 12, 13, whatever, how many of the patients are on the unit, and you have two. So just bear with me. If you see something, help me. Like tell me,
exactly.
like, hey, you forgot. Like, don't forget this. I'm like, oh yeah, thank you so much. I got caught up with something. It's not like I'm
Yeah,
just like, sitting around doing nothing. A lot of times it's because I'm doing 10,000 things at the same time. So just allow the practitioners, whether it's a doctor, a nurse, a resident, whoever it is, just allow them some grace and give
exactly.
them the
Exactly.
opportunity to fix whatever was missing and just bring it to their attention. And
Yeah.
and that is just for patient safety and just working as a team.
And as a
That's all.
team, yes,
It's a
yes, and
team.
that is something that used to make me very impatient with people and telling me, as you say, it wasn't ordered or they didn't do this. Well, did you bring it? Did you? I think it's a human being, just like you're a human. It's a human being. So
Correct.
anyway,
Yes.
so, so looking back though on your journey. Well,
Hmm.
I need to go back and ask you this though, because you wanted to be a nurse like your mom's. Before I even get to my other question,
Hmm.
did you, when you started this out, when you started out wanting to be a nurse, did you see yourself as a nurse practitioner, or did that come along the way?
That came along the way.
Hmm.
That came
So
along the way.
that being the case, what was there a moment that you said to yourself, or an incident that you said to yourself, I need to flip the switch. I need to go into this other space.
That's a good question. So, I was working in cardiac surgery,
Mhm.
and I was already like top, like taking care of the sickest patients. I had my CCRN. I
Mhm.
was very like that was top tier in what I was doing at the
Yeah.
time. And I said to myself, I was like, what else can I do? Right? Because I felt like when everything starts to become
Mhm.
like you know what's going to happen next, that's when it's time like you're no longer being challenged. So I felt
Yeah.
like the challenge, I was no longer challenged. This was just becoming a routine.
Yeah.
And I said, I need to be challenged. And I said, I don't want to work in trauma. I don't want to work. At that time, I didn't want to work in medical ICU. There was no other ICU that I wanted to work. So I said, so what's next? So the next thing is, okay, you know what? I need to be a nurse practitioner because I need to be challenged. And right now, there's no other place in nursing. I worked in cardiac cath lab. I worked as a traveler for some
Mhm.
time. I worked in med surge. I worked in then cardiac surgery, and it's so many different areas that I had already worked in. And I felt like there was no other unit I wanted to work on besides the unit I was working on. But I also didn't want to work there anymore either. So it was just like, okay, so where am I going to go? I said, you know what? I'm not being challenged, and it's time for me to level up again. So that's when I decided to go back to school.
Mhm. 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 One of the things people are talking about a lot these days, of course, is technology and AI and all of this in healthcare.
Mm-hmm.
When Janelle, you heard, again, I'm going to come back to your almost 20 years. When you look back, I know
Mm-hmm.
you've seen a lot of changes.
Mm-hmm.
When you look ahead, what do you think you see?
So I see that there's going to be a lot more. So the problem is people are relying heavily on AI,
Hmm.
and AI is great as an adjunct, but not for you to 100% depend on AI. Like that now becomes your brain. So
No.
you have to use your own brain to think and allow AI to be an adjunct to that, not to replace your brain. And that is what I think is happening. People
Hmm.
are so into AI that they don't think for themselves anymore. You still have to think. AI
Yes.
can AI can help you magnify what you already know, but you still have to be able to think on your own and not 100% be dependent on AI to now just take over your entire brain.
I
And I
know.
think that is what you're thinking. Like you don't think anymore. You just put something in an app and get an answer. Like how about we utilize those brain cells and think? And if we can't figure something out, then we say, okay, let me use AI as an adjunct,
Yeah.
not just
Yeah.
to take over everything.
As a possibility thing to say, hey, did you forget this, or this? Yeah.
Correct.
Yeah.
Correct.
Yeah.
Adjunct. Yeah,
Yeah.
not 100%. It's an adjunct, but people are
Yeah.
using it as 100% and they have no idea
No.
behind the thought process or anything like that. And they're just reading off of AI. It's like,
Yeah.
no,
Yeah.
no.
Yeah. Your
Hmm.
mom was a nurse. What advice did she give you?
So my mom pretty much said, you know, she said, I hope you know that nursing won't be easy. She told me, but I didn't believe her. I didn't believe her. And one of the things she always said to me was, always put God first in everything that you do.
Mm-hmm.
Pray before you go to work, and you cover
Mm-hmm.
yourself and the patients that you care for.
Mm-hmm.
And I thought that was like excellent, and I still do that up to this day.
Mm-hmm.
So before I see any of my patients, I pray that I ask God to bless my hands so that I bring life and not death to my patients, and that you help me to be clinically astute to make good decisions so that I can make my patients better. And that's my prayer every day.
Okay.
Yeah.
Okay. So the second part of that is, what advice would you give to someone who wants to be a nurse? Someone just, it's graduation season. People are coming out of high school.
So I would tell them, listen, don't look at what you see on television where these nurses are going on vacation, and that life is
Mhm.
great and that nursing is easy, and that I said it's a hard job. It's a lot of work. It's a lot of responsibility. And nursing school is not easy, even though you might see lots of people that are
Mhm.
nurses, and
Mhm.
they see, and you're like, oh, you just become a nurse and you just make all this money, and you're like, you may start and not make all that money. Okay. You may start and have a hard time, so it's like, I don't want you to think that what you see on television and on social media is that's an actual real life
Mhm.
nurse. Okay.
Mhm. Mhm.
Yes, you can go on vacation and you can do all those things, but there's a lot of that goes on into getting to that stature initially. Like, you may not make as much money, you might be a lot more stressed, you may not initially like nursing when you start
Yeah.
out. So
Yeah.
you have to come in prepared to work, to be sometimes be overwhelmed, and it'll take you time to transition and be comfortable. So your goal initially will be to take safe care of your patients, transition from task oriented nursing to critical thinker, and then eventually you'll come to that point where you're comfortable and you could get another job and all these things. So it's not an easy job. It's a hard job. So just
Yep.
understand that it is not easy. So don't
Yep.
be fooled by what you see on social media. Nursing is hard. Understand that. So and nursing school is hard, and being a nurse is just as hard. So
And
don't
it's hard on
overlook
many
that.
levels.
Hard on many levels. So
Mhm.
don't think that it's an easy job because of what you see.
Yeah.
It's
Yeah.
not easy. And come in prepared knowing this,
Yep.
honestly.
Yep. Yep.
Mhm.
Yep. You can get your cute little scrubs and all that, but
Yep,
get your
it's more
spine
than
as
just
well.
your cute fake scrubs, and your hair is done and your lashes are on point, and it's a lot more than that. It's a lot more than what you see. I promise you, it is.
Oh dear God. Anyway, lastly, Janelle, we're talking
Hmm.
a lot about caring for ourselves. So two
Hmm.
questions again. What does self-care mean to you? And what do you do to care for you?
Self-care for me means that you love the person that you are, the person that God made you to be. That's self-care. So when you start from there, everything else will follow. You're going to eat proper food. You're going to make sure you get enough sleep. You're going to not sacrifice your health for a number on the scale or to look a certain way. Like, everything that you do is going to resort back to the fact that you have self-love.
Mm-hmm.
That is
Mm-hmm.
self-care. The true definition of self-care is self-love, because when it starts from there, everything else after then is going to be self-care.
Mm-hmm.
Okay? So
Mm-hmm.
when you start
Mm-hmm.
with self-love, self-care will follow. Because if you don't love yourself, then you don't care for yourself. You don't talk
Mm-hmm.
good, you talk
Mm-hmm.
down to yourself. You speak
Yeah.
negatively over your life, right?
Yeah.
Everything that you say, you speak over yourself, has to be positive. What you tell others, it needs to resonate with you also. What you wouldn't tell somebody something negative. So why would you say that to
Don't tell it
yourself?
to you. Mm-hmm.
Yes.
Mm-hmm.
So that's all a part of self-care. Besides getting a massage and getting your hair done and your nails done and things like
Yeah.
that, it's like taking care of your brain, how you think, how you respond to situations, how you balance your nervous system. That's
Mm-hmm.
true self-care,
Mm-hmm.
self-love. That's self-care for me. That's my definition of it. And that I
Okay.
understand it after all these years.
I'm glad you said it because that takes a while to get to come to. Especially
Yeah,
I think in this profession where a
correct,
lot of the focus is directed outward towards,
correct.
and surely it should be, but
Yeah, it's always outward, but really it's an inner game.
it's an inner
It's an
yes.
inner game. It's not an outer
Yeah.
game because outer will come, but inner will may never come. You have to work on that.
Yeah.
Yeah.
Yeah. What are your hobbies?
So I like to I pretty much I like to well, I don't like to exercise, but I do focus on my health. I like to get my nails done. I want to make sure my hair is done, my brows. Like I just kind of
Yeah.
do like
Yeah.
facials, like just kind of do
Mhm.
like those things to make help me feel like okay, I'm
Yeah.
keeping up, even though sometimes I feel like I'm falling apart.
Yeah. I know
But
what
at
you mean.
least like if I look well, then I'm like, okay, I can pass.
Yeah. Because you know what though, really, I get that because it's like again, it's like food, you know. The eyes
Hmm.
tell a lot. What you see, everything we judge, especially for ourselves, first of all, start with, oh gosh, I look tired today in the mirror, or you know, oh my hair needs to get
Yeah,
what,
honestly, yep,
what
that's where it starts.
it starts there. So I get that.
Yes,
All right, Janelle, thank you so much for this conversation.
thank
It's been fun.
you,
It's been
thank
informative.
you.
It's been fun. Thank you so much.
Yes, you take care. Thank you for having me.
A pleasure. My
Okay,
absolute pleasure.
all right, take care. Bye.
Bye bye.